everyone. I know it's been a while since I've done a sit-down video with you, so here I am. Welcome on board, everyone. For my day ones, thank you guys for always tuning in. If this is your first time here coming across my YouTube channel, my name is Lillian and I work as a registered nurse here in the UK. Welcome on board. So guys, in today's video I am going to discuss or explore the meanings behind popular medical terminology or abbreviations that we use in the UK in healthcare system. The reason is understanding these abbreviations are very important to empower you to comprehend medical documents or a discussion with your healthcare providers. Even if you're a patient and maybe in your discharge letter you see some of this abbreviation, you can understand what they mean. So if you're a nurse or a healthcare provider, make sure you are familiar with the policies and guidelines of your trust that you work. So I have actually written some of them down so that I don't forget. Okay, so there are so many abbreviations, like hundreds of them, so obviously I cannot go through all of them, so I will just mention several of them that we really commonly use, especially when we are documenting patients' records or when we are communicating in the handover. So first one is the GP. So GP means a general practitioner in the UK. This is like a family doctor. Most people that live in the UK, they all have a GP where like they hold your medical records, or if for example you want to be referred to a specialist, you have to go through to your GP. GP, general practitioner, is a very important person here in the UK when it comes to healthcare. Another abbreviation we use is A&E. A&E means accident and emergency. This is where, for example, if you feel unwell and it's in the middle of the night or your GP is closed, your general practitioner, which is your doctor, the surgery is closed, you can go to the A&E. Or for example, when people have accidents, they are taken to A&E, accident and emergency. I think this abbreviation is used in different countries, is the same. Another abbreviation we commonly use is BMI, body mass index. This is when we are assessing someone's weight. Maybe they are malnourished, maybe they are overweight. We calculate with body mass index. Another one is FBC, which means full blood count. It's a blood test that we normally do for our patients. If for example they are not feeling well, we have different types of blood tests. There is like CRP, there are UNEs, all this. I can do a separate video of different abbreviation of blood tests and what they mean and what we look for in those blood tests. Another abbreviation that we use is NBM. NBM stands for nil by mouth. So this abbreviation is so important for a healthcare profession to adhere to or to follow and make sure, because this means this patient should not be given anything orally or through the mouth. So it's usually on or even when you're documenting, you can say patient is nil by mouth, NBM. Or maybe if a patient is in a ward, they will put that abbreviation on there where the name is and the document, like, so that everyone that comes, because you know it's a very natural instinct when you go to a patient and maybe you see they are dehydrated, or maybe because sometimes the patient does not understand that they are nil by mouth, so they might ask you for a glass of water, and then if you end up giving them the glass of water, that is so dangerous because they are nil by mouth. So that's very important too. Another very important abbreviation, medical abbreviation that we use here in the UK is PRN. Actually, I will put all this abbreviation here or here, somewhere here, and then you can see PRN. This means as needed. For example, a patient may have analgesic or painkiller like paracetamol, and they don't really need it all the time. They can use it only when they are in pain. So that's when it's called paracetamol PRN, like when needed, only when needed. Another abbreviation, very common one, is POC. This means package of care. So in the community setting, a lot of patients, they have carers that go and help them with activities of daily living. So the whole package of care is usually allocated to them, and this POC usually goes on with this other abbreviation like QDS. This means 4 times a day. So a patient has carers 4 times a day, QDS. So when I'm documenting, sometimes you can say patient has POS QDS, which means patient has a package of care 4 times a day, or TDS, which means 3 times a day. BD, which means 2 times a day. OD means once a day. So I think these abbreviations in other countries, they are termed differently. I'm not sure. You let me know in the comments if this is how you also use them there. Another very common abbreviation or terminology that we use is SOB, which goes along with DIB. So SOB means shortness of breath, and DIB means difficult in breathing. So sometimes you might see documentation like patient was comfortable, no SOB or DIB means patient was comfortable, no shortness of breath or difficult in breathing. Another very common one is UTI, which means urinary tract infection. This is when you're assessing a patient, you might look for UTI symptoms. Is to check if mostly is to do with the urine, like it says urinary tract infection. So you check symptoms like is the urine smelly, is the urine dark or cloudy, is there frequency of urination. So all that is symptoms of UTI. Another common terminology is ENT. This means ear, nose, throat. So this is like a specialist department where patients are referred to be assessed ear, nose, throat. Another very common terminology is DNR. This means do not resuscitate. I have to do a separate video about this. This is when, like, if you visited a patient or a patient is under your care and they have a DNR in place, so that means you do not resuscitate them if they deteriorate, okay? So another one is NNV, which means nausea and vomiting. We use it a lot when also documenting, or when someone is explaining their symptoms. So you can write no N and V, like no nausea and vomiting, patient was comfortable. The last one I'm going to talk about is COPD, because there are so many, I can't finish them today. COPD stands for chronic obstructive pulmonary disease. Okay, this is a health condition. And that's it for today's video, guys. Thank you so much if you've watched it all the way to the end. I really appreciate. Please let me know in the comments section, what are some of the abbreviation or medical terminology that you use in other countries if you're not based in the UK? What are the terminology that you use in your country? And if you are based in the UK, please list down the other abbreviation that we use here. It's just for learning purposes, and so we can learn from each other and other people can have the knowledge of what this abbreviation means. Lastly, please, if you haven't subscribed already, please hit that subscribe button and the notification bell as well, so that every time I upload a new video, you will be notified. Please don't forget to share this video, leave a comment, like. You just never know who it might help. We are here to inspire others, maybe especially the young generation that wants to become healthcare professionals like nurses, doctors, physios, or all other healthcare profession is involved. So until the next one, guys.